So as Patty said, my name is Anna Scherzer. I'm the epidemiologist with the Mojave County Department of Public Health, and I have a number of my colleagues here present tonight. And our goal here is to give you guys a basic, informative session on Ebola virus and to answer any questions that might be brewing in your mind. So first off, I want to point out that this presentation was designed to provide a general overview of what's going on right now in West Africa. So it's a general overview of the 2014 Zaire Ebola virus outbreak in West Africa, and we want to highlight the current preparedness activities of the Mojave County Department of Public Health and our partners in the community. The intended audience for those here tonight is employees of Mojave County. So that's who this was actually designed for. We're not looking at doctors and not necessarily looking at nurses except for those who play that role within the county health department. The information contained in here is absolutely subject to change as the outbreak evolves and possibly grows. Information becomes available and things change with time. The Ebola virus was discovered in 1976 near the Ebola River in Zaire. Now, the timing is probably more having to do with the point that in the 1970s, science advanced to the point that we could actually start identifying and seeing viruses and understanding the genetics of viruses. So the virus has probably been out there for much longer. But since 1976, it's had a name, and we've known what it looks like, and there have been outbreaks of Ebola virus since 1976, all the way up to today. The outbreaks since 1976 have all occurred basically in Africa. The first one was in Zaire, which is now the Democratic Republic of the Congo and the Republic of the Congo. There's been additional outbreaks that have occurred there since 1976. There have also been outbreaks in Gabon, in South Sudan, and Uganda. So in the past, there's been a number of outbreaks in Africa. What we're looking at right now is a new area, a new region of Africa. So the current outbreak is epicentered in West Africa in the three countries of Guinea, Sierra Leone, and Liberia. You'll be hearing those three countries over and over and over again tonight. Those are the three countries that have the highest number of cases, where it all started, and where the hugest problems are. There have been cases in Senegal, Nigeria, Spain, the United States that have all been tied to these three countries. There have also been folks who have been sickened in Sierra Leone or Liberia or Guinea who have been flown out to different countries for treatment. And that includes Germany, England, France, Norway. There's a number of places. But the point is, by far, the greatest activity has been in the three countries in West Africa: Guinea, Sierra Leone, and Liberia. In nature, this virus persists in animals. So Ebola virus is what's known as a zoonotic virus. It exists in animals and it persists in animals. Sometimes it makes animals sick. Sometimes animals can be infected and not sickened with the virus. It is well established that this virus can infect monkeys and other non-human primates. There's also a number of antelope-like creatures in Africa that can carry it. And the most likely reservoir of this virus, so the place where it is always going to perhaps remain and where it's been in all time, is in fruit bats. It hasn't been absolutely proven, but that's probably the reservoir of the virus. How does it jump into humans? The answer is most likely in Africa through the consumption of bushmeat. So cases where individuals hunt, butcher, and eat some of the animals that can be infected with Ebola virus. And that is most likely the way that it jumps into humans. Once it's into humans, as you will see as we go on, it can be transmitted from human to human. The signs and symptoms of Ebola virus disease include fever, severe headache, muscle pain, extreme weakness, diarrhea, vomiting, abdominal pain, unexplained bleeding or bruising, and then there can be some other types of things like red eyes, sore throat, and things along that line. What I want you to notice right off the bat is that those are not very specific signs or symptoms, with the exception perhaps of the last one. All those others on the list are probably things you and I have suffered from in the past and will probably suffer from at some point in the future. And that's one of the tricky things here, is that many of the presenting signs and symptoms are not specific, straight out going to point to Ebola virus disease. The symptoms in a person appear about 2 to 21 days after you've been exposed to the virus, and usually it's about 8 to 10 days after you were exposed. So if you pick up the virus from another person, one can expect that 2 to 21 days later, you might come down with one of these symptoms. Usually it'll be within 8 to 10 days. This is of extreme importance because Ebola has graciously given us this little fact, and that it can only spread when people are sick. This is different from basic diseases like influenza. You can spread influenza before you ever get sick with influenza. Ebola, you can only spread once you get sick. So that is going to be one of the underlying themes of what we talk about tonight. You cannot spread Ebola virus unless you are sick with Ebola virus. The 21 days, you'll see more and more coming out of the 21 days as we proceed on, because if you happen to be exposed to Ebola virus and you can make it through 21 days without getting sick, you are not going to get sick with Ebola. So that 21 days is an important marker and milestone. The illness itself is usually an abrupt onset of fever with headaches, chills, malaise, myalgias. You basically feel crummy. I see a lot of places say that there's an extreme weakness, but it's an abrupt fever. It doesn't necessarily sneak up on you. You definitely feel crummy. And then in many cases, it goes on to some level of vomiting, diarrhea, and abdominal pain. Some cases exhibit hemorrhagic symptoms. So that's that idea of bleeding out. So your blood vessels become leaky and you start bleeding internally and in some cases externally. That used to be one of the hallmarks and one of the basic pictures, I think, that Ebola virus would conjure up 10 years ago. But you notice that only, less than half of the cases of Ebola virus actually exhibit those types of symptoms. The virus quantity that a patient has, once they're infected, it grows exponentially from that point of infection. If death occurs, it's generally within 9 to 10 days after you first get sick. What's important about that viral load, once you get infected, the sicker and sicker and sicker and sicker you get, the more virus there is inside of you. Your highest viral load, the point when you are most likely to pass the disease, is at the point that you're dying or after you die. Patient care generally involves giving the best supportive care we can. There is no cure, and looking ahead, there's also no vaccine in terms of prevention. There's no specific cure, there's no vaccine. The best care that you can get is supportive care. One of the big problems happens to be dehydration, so we have to provide clients and patients with IV fluids and rehydration, and in Africa, rehydration salts. Have to keep electrolytes balanced, have to maintain blood pressure, oxygen status, those types of things. There's no special magic medicine that we can give you, but we can do your best to help your body fight the disease. There is that experimental drug known as ZMapp that's been in the news recently. It's an antibody therapy. So the idea of that experimental drug is to give it to a person and it boosts their immune system a little bit with those antibodies. Now, I'm no expert on ZMapp. I do understand there's not a whole lot of it out there in the first place. I don't know who decides who gets ZMapp. I don't even know how much of it is even realistically available. It's an experimental drug. They were not planning, and they were not timing anything to go along hand in hand with this outbreak. So they were really just preparing for experimental trials of the drug. And so there were no great stockpiles of this anywhere. The other thing that they've been doing is blood and plasma transfusions from recovered cases. And the idea there is the same basic premise. Get the antibodies from somebody who's recovered and put them into somebody who's currently suffering from Ebola virus. It is not clear how useful those blood transfusions or the ZMapp itself is. Some people who have received the experimental drug have survived, some have not. And it's not clear what role those drugs played in their recovery. Who's getting sick with Ebola virus? The bottom line is that the people who are getting sick are the ones who are in direct contact with those who are sick or died of Ebola virus. People who provide direct care to Ebola patients can come down with Ebola, okay? That's two different choices of people. In the United States, the most likely people who are going to be caring for patients sick with Ebola are going to be healthcare workers. In other places, such as West Africa, where the hospitals are overflowing and there's associated problems with the healthcare system, there's a great deal of patient care that occurs in the home, in the bedroom of the home. So a family member or an acquaintance or somebody is providing care to that individual. So people who are providing direct care to Ebola patients are the ones who are getting Ebola. And in Africa, there is a huge amount of transmission that can potentially occur after a person dies. And this is not something that I see as being a huge problem in the United States. But in Africa, the traditional burial and funeral rites associated with a person, usually you die in your home, and a family member or an acquaintance washes your body with bare hands out of a bucket of water, probably in a home that doesn't have running water in the first place, or electricity for that fact. They wash the body, they might wrap the body, they might dress the body, they prepare the body, they put the body in the coffin. And there is a lot of activity that doesn't take place in a funeral here in the United States. For example, it is not taboo to touch the body of the person who died. And many of the people, to show respect to the person who died, touch the face of the individual, either during the funeral or certainly during the preparations of the body. It's also common to kiss the body. So what I just mentioned before is that you are most contagious when you die. And now we have individuals out there who are washing a person who is terribly contagious with bare hands, potentially touching and kissing the body. So there's a great deal of transmission that is occurring in Africa in a manner that is not likely to occur here in the United States. How does a person get the virus? The underlying theme you see here as we go through these points is direct contact. You have to be in direct contact with the body fluids of a person who is sick with or has died of Ebola. Body fluids does expand a little bit further than most diseases we're familiar with. Yes, a person who dies of Ebola virus can have Ebola virus in any number of body fluids. The three most important ones are blood, feces, and vomit. But you can, in fact, have it in the urine. You can have it in the sweat. You can have it in the saliva. You can have it in tears. You can have it in semen. Any body fluid in terms of Ebola is fair game to be infectious. You can get Ebola virus from direct contact with the body or with objects contaminated with the virus. Again, this should not be a huge problem in our healthcare system or in our culture or in the United States. But there have been in the past outbreaks of Ebola virus in Africa that have occurred because needles were being reused. between patients. You could potentially have Ebola virus pass through direct contact with medical equipment that has been contaminated with Ebola virus. Not likely going to happen in the United States, but it is possible. And of course, the other piece of the picture, which is another part of the picture that I don't think is going to be a huge problem in the United States, is that you can also get Ebola virus, as I mentioned before, from direct contact with infected animals. Those would be the animals that can carry Ebola virus that do not live in the United States. So we're talking about African monkeys, some of those antelope species, those fruit bats, those types of creatures. That's where you can get Ebola virus from. So if you happen to be in Africa, you happen to kill one of those animals, hunt them, butcher them, and then consume the meat, there is the risk of getting Ebola virus. Cooking will kill the virus, but the process of butchering an animal in Africa is usually done with a machete, and it's not a very clean, sterile environment, that process. I want to point out that Ebola virus is not an airborne virus. What that means is I could be infected and I could be dying of Ebola virus in front of you right here, right now. But there is no way that virus could come out of my body and float in the air back to any of you and infect you. That's what airborne transmission is. So things like cold and tuberculosis and those types of things, those can be passed through the airborne route. That means it gets into the air and it can travel great distances. It can go up into the ventilation system and be carried elsewhere. Ebola virus cannot spread like that. It is not an airborne virus. It just simply can't happen. You will not get Ebola walking through a hospital, walking by a person, talking to a person, even if there's an Ebola client in that hospital, even if the person you're walking by or talking to has Ebola. You're not going to get Ebola spending time with a person who has no fever and feels well. It doesn't matter if they just came from Liberia. You can only be contagious once you have the symptoms. So if the person is feeling well, doesn't have a fever, doesn't have symptoms, doesn't matter where they've been, they can't give you Ebola virus. You will not get Ebola attending a funeral in the United States. You will not get it through the air, through the water, or from legally purchased foods in the US. And of course, that caveat is, unless you're eating bush meat, unless you're eating chunks of meat that is originating from butchered animals in Africa, you're not going to get Ebola virus. You also will not get Ebola virus from your dog or cat or your other pets, or from a bug bite, including mosquitoes. As far as the environment is concerned, we've pretty much clarified people are contagious with Ebola virus once they're sick. In terms of the environment, this is not a very hardy virus. It's pretty easy to kill. Sunlight, UV light kills it, heat kills it, drying up, dehydration, desiccation kills it, bleach solution, basic bleach solution kills it, and of course, all the hospital disinfectants. So all the procedures that hospitals use for sterilizing their environment right now, for all the other diseases that are out there, they also work for Ebola virus. There's no secrets to Ebola virus. What is public health doing to prepare for the possibility of Ebola virus showing up a little bit closer to home? We are keeping up to date on the most recent guidelines and updates, and there's many different ones for that. There's for clinicians, there's for protective equipment, all those types of guidelines and updates. We have to keep on top of that, and as things evolve and change, we have to keep up with those changes. We're distributing and releasing information and some of those guidelines and those updates, and we're sharing training opportunities with our local hospitals, with our other healthcare providers, with EMS, the fire departments, law enforcement agencies, anybody else who asks, schools and whatnot. We'll work with them and help dispel some of the rumors and share information best we can. We're conducting lots of public education, just like this right here, right now. And we're educating, training, and exercising ourselves internally amongst ourselves, and also in conjunction with the hospitals and other players and partners in the community. And so for those of you who exist out there in the world of emergencies and whatnot, the line on the bottom means something to you. We're currently working under incident command. All that really means is this means that we are taking this very seriously. Very seriously. What would public health do if a case was identified here in Mojave County? So there's a bit of activity that we would be conducting. First off, we would want to be conferring with our healthcare facility, whoever's identified this person. We want to assess the risk in our course of action. So what is the real likelihood that the person who you've got in your care has Ebola? Should we test them for Ebola? Should we draw some blood and test for Ebola? That's a decision that would have to be made during that initial risk assessment. We are responsible for coordinating lab tests. It's not a complex test. To find out and confirm that a person has Ebola virus is not a very tricky lab test. However, there's only one place in the state of Arizona that can do it, and that is in Phoenix at the Arizona State Public Health Laboratory. So your health department would be working hand in hand with whoever's identified this case and whoever has this case in their care, and the state health department and also the laboratory to determine whether this test should be run and to get that test to the state lab and get that case confirmed or ruled out. We would also be conducting interviews with the patient. We want to know where they've been. Who have they been in contact with? Did they perhaps care for a person with Ebola? We've got lots and lots of questions for that person. We would conduct what's known as contact tracing, which is probably what you guys are all concerned about. Who might that person have passed that disease on to before they showed up at the hospital? That's part of our risk assessment. That's part of our job. And it is our job to identify the contacts who were with this person during a period of time when they could have been contagious. We are to identify those people, and we are to interview them, provide advice for them, and we need to follow up with them really closely, make sure they don't develop a fever or any other symptoms for that magical 21 days. If they do develop a fever or symptoms, then we would also need to take care of that. So ideally, we would be able to identify all those people who could have potentially been exposed to this person and could have picked up the virus. And you remember, you're only contagious once symptoms show. So it doesn't matter at the outset who has been a contact to the person. What matters is if those symptoms show up. And if you can make it through those 21 days, if you don't get sick, you're not going to get Ebola virus after that. We would indeed consider isolation or quarantine, and there's many levels of that. You probably see in the news that there's voluntary isolation. Okay, if I feel that I was exposed to a pretty strong case of Ebola virus, I might voluntarily say, you know what, I'm just going to stay home for the next 3 weeks. That's what voluntary isolation is. There's other levels, and of course it can go up to the level of quarantine. So those are all considerations that we would have to be making on a case-by-case basis. But those are all things that the health department has the power to impose and considerations that we would have to make. We would also be providing updates and situational awareness to our partners and to the public. So to let people know, if cases are becoming symptomatic, things along those lines. The take-home messages that I want you to understand is that Ebola is going to only spread when you're sick with Ebola. You have to be sick. You cannot get Ebola from a person who is feeling well and not sick. You can only get Ebola from directly contacting the blood or body fluids of a person who is sick with or who has died of Ebola. You can get Ebola virus from touching objects that are contaminated with the virus. So things like medical equipment and needles, which again is not a big, huge concern to the general public. And yes, you can also get Ebola from touching infected animals, their blood or their other body fluids, or their meat. And that's the bush meat trade, which is entirely illegal in the United States and also most of the places in Africa, and highly, highly, highly unlikely here. To stay informed with the most up-to-date information, we will be posting our most up-to-date information on our Healthy Links website, and then we also have a toll-free number that will have basic information, and it presently has basic information. And of course, the best place that we look for guidance, if you want to go straight to that guidance, is at the Centers for Disease Control and Prevention in Atlanta, and their website is full of information. If you picked up one of these pamphlets in the back, you will notice that on it is a Healthy Links website and also that 1-800 number. And there's also some radio stations, but we are nothing near the point of having to put any type of information on the radio. So that's for you to take home if you want to keep up to date and you want to remember where to look for that information. Now I'm going to turn it over to Christy Bronston for a few minutes.
Good evening. And I had the difficult part of the presentation. I'm going to take just the last few slides here, a couple slides, and describe some of the most common questions that we may get regarding Ebola. And then we will turn it over to you all to ask the questions that you have. So one of the most common questions that we might hear is, what do I do myself, personally? What do I do to protect myself from Ebola? Now, to restate what Anna had just covered, avoid unnecessary travel to the areas that have Ebola cases. And this would include Liberia, Guinea, Sierra Leone. If you happen to find yourself in West Africa, avoid contact with these wild animals and the bushmeat that she covered. Also, do not touch the body fluids of someone who is sick, and avoid handling human remains of someone who is or was sick. This may seem a little obvious to us, but as she mentioned, in some cultures and some religious practices, this is a common practice. And so these practices can also be practiced here in the U.S. So if you have, if that is part of your culture, we would obviously recommend avoid handling human remains. Now, the more common things that I think that each of us can do: stay informed, get the facts, make sure that the information that you're tapping into, that we have access to, is credible. We have access to much information over the TV, the internet, Facebook, and other routes of media, and not everything that we see on these and through these avenues are facts. So really the best way to keep informed and to know how to protect yourself and your family is to make sure that you have access to credible information. And some of the resources that we recommend that have research-based, evidence-based practices, the CDC's website, the World Health Organization, the National Institute of Health, and as Anna just mentioned, also our website, thehealthylinks.com, and then our toll-free number as well. Those are just a few of the resources. If you're interested in other resources, you can certainly contact the health department and we'll be happy to provide some for you. The other thing, use some common sense strategies. Put into practice some general cleaning, a routine cleaning procedure. This is in your work environment, but also in your home environment. Wash your hands frequently and avoid people who are sick. If you happen to find that you are sick, we always recommend that you do stay home. Okay, the other question, what do I do if I think I've been exposed to Ebola? First of all, we recommend, obviously, remove yourself from the situation. Now, this could mean any number of things. You could find yourself in a situation, but if you find that you are near someone who is ill, remove yourself as much as you can, okay? Provide some distance between the person who is ill and yourself. contact your supervisor. You know, as county employees, we know that if there's an exposure of any kind, that we should be contacting our supervisors immediately. Our supervisors with us can consult with risk management and occupational health and public health if necessary. So immediate notification to your supervisor is really important. And if you do experience illness, again, stay home and call your healthcare provider. Now, we've heard this recommendation before to seek medical care. We do recommend that you call your provider and tell them that you think you may have been exposed to Ebola. Always a good idea. If you think you might be infectious, just stay home and then let's seek the resources needed. So those are really the common questions that we have on the slides. What we want to do tonight is turn it over to you and answer the questions that you have. So I'm going to ask Anna to come on up, and we'll see if we can answer some of those questions for you.
While Christy's preparing there with the microphone, some things that I probably should have mentioned. There are 0 cases of Ebola virus in the state of Arizona. The cases that are in the United States are folks who have picked it up in Sierra Leone or Liberia or Guinea and have been flown back home for treatment. And then also the 2 nurses who were in treatment that were in contact with the first case that was in Texas. So in case you've been seeing rumors or whatnot out there, there are no cases of Ebola virus in Arizona. And I think most of the cases that are out there, you've probably already heard a little bit about. So we have no secrets beyond that. What questions do you have? Anything? Do not leave tonight without everything being answered. Anything is fair game.
Since Ebola is contacted by body fluids, etc., is it possible that the terrorists can put it in our drinking water, and can we be affected by it?
That is a very good question. I must tell you that the entire reason I am standing before you today is because I was hired 10 years ago because of concerns about bioterrorism. And that is the division that I work with here in the health department. And the answer is yes, it has always been considered a possible bioterroristic material. There is no proof and no evidence that it would be a very effective biological to use for terrorism for many different reasons. And the water supply, there are good reasons to think that using the water supply to pass many of the terroristic types of organisms probably isn't the best means available. So we have been thinking along those lines for a long time, but it's not at the top of the list of microbes that we would be concerned about for bioterrorism.
One of the things that has been asked is, I believe most of the county departments are already, if they have counters, they're already practicing cleanliness and cleaning the counters, and they've got wipes. But I believe Patty is working with procurement to make sure that we have the sanitary equipment that's necessary, and if departments are wanting to have the cleaning washes or wipes, what I suggest is the individual employee contact their supervisor and request those supplies through their department head or through their supervisor.
Okay. And I would also point out that the likelihood of getting an infection of Ebola virus from a surface here at your workstation is not very high, but one of the beautiful things that those types of actions can do is it can help lessen the possibility of you getting a different illness that you think might be Ebola virus. So just by simply preventing all those general signs and symptoms from all those other types of infections that you're much more commonly going to get here, those types of actions are definitely going to help to decrease some of those infections and maybe put you a little bit more at ease.
And a flu shot would help that as well. Just thought I'd add that.
I introduced myself to you earlier as the custodian for the Sheriff's Department, and it is important for me to know the proper ways to sanitize, the lobbies and where the public comes in. And as of now, of course, I try to practice the standard cleaning methods. So my question is, you had mentioned that most disinfectants that we have now are suitable to kill this virus. How do we, it's a kind of a two-part question, how do we know that? Because my disinfectants do not say that it does kill Ebola, other than the fact that it's not a very strong virus, is what I'm assuming. And then my other question was, if it's not airborne, would that also include someone sneezing on you? If they're in the lobby where I work and they sneeze, they put their hand on a chair. I'm just I want to get a little clarity on airborne versus sneezing.
Okay, why don't I start by answering the second part of your question, and then I'm going to turn over the first part of your question to Rachel there. Hopefully she'll remember all those parts of there. But you actually crossed into a zone, which is beautiful there, the question about sneezing and airborne and this and that. One of the most confusing ideas that I ever remember running into when I was in school in microbiology was this idea of droplet spread and airborne spread and the way that things are transmitted and direct versus indirect. I think there's a whole area of microbiology I completely failed and never caught on to, but I'm slowly catching on to right now. So what I want to clarify is that an airborne virus is one, like I said before, that I might accidentally sneeze out or talk out or laugh out or cough out right here, right now, in front of you. A true airborne virus can come from that action of me, if I'm infected up here, pass into the air and persist in the air for a long period of time, long enough to spread to other parts of the room, long enough potentially to enter up into the ventilation system and be carried off somewhere else. That's what an airborne transmission means. That does not happen with Ebola virus. However, I've already told you that basically any fluid is fair game for a person who's terribly ill with Ebola virus. That does include saliva and mucus, so all those nasties in your nose and mouth. It is theoretically possible, in theory, for a person who is very sick and contagious with Ebola virus to sneeze out some of that virus or to cough out some of that virus in a sneeze or a cough or a laugh or whatever, expel it from their body. It is theoretically possible that that could go from that person directly into another person's mouth, eyes, nose, or a wound in their skin. That is the difference. As nasty as it sounds, those droplets and those particles and that mucus and that comes out of me has to go directly into your mouth or your nose or your eyes or a wound in your skin. That's not going to happen once you get beyond about 3 feet from me. So that's the difference. It is theoretically possible for a sneeze or a cough. It has not been shown. It has not been documented. The one thing that healthcare workers are taught to be careful with is the possibility of some of that happening during a medical procedure. So ventilating a client or something like that can create some of those particles. And again, they're concerned about those people who are right there for that procedure. It's never going to get and float around the room and get further or persist out there in the air. And of course, what's happening to those droplets after 3 feet? They're gone. They're falling to the ground. All right, the first part of your question about actual cleanup.
Yes, so you're going to use a disinfectant that's effective for non-enveloped viruses, and is listed by the EPA, but you can also use a 10% bleach solution, so be 1 cup of bleach for 9 cups of water. Now, we have been working with Annie in procurement to get EPA-approved disinfectants that will work. So you should be provided with that if that is what you want. I think you just need to talk to your supervisor, like our administrator here mentioned earlier. As far as cleaning, if it's not visible, like if there's not a visible spill, you're just going to use that disinfectant on the surface. If there's a visible spill, you want to make sure that you clean it up with soap and water first, because the organic material can inactivate the disinfectant. So hopefully we're not dealing with anything visible and we're just doing prevention at this point, but they will be providing you with some good disinfectant for this. And also, I believe that risk management is going to be doing some training on our bloodborne pathogen and exposure control plan, and that should be part of that training as well.
Okay, I also want to mention that bloodborne pathogen training is very important because obviously that's the reason we want you to notify your supervisor if you think an exposure has taken place, because we want that cleanup to happen by somebody who is trained and has the appropriate equipment and has been trained with that equipment to be able to clean up a potential a problem. Okay, so we don't expect for just everyone to be picking up vomit or things off of the counter. Okay, there are procedures for that, so contacting your supervisor and having a conversation with risk management is very, very important.
What other questions do you have?
I have a comment first. Supervisor Watson was not able to be here this evening, but he did want to say that he's proud of Mojave County, that they're taking the first step in the Southwest Transportation Corridor by having this meeting to let you know what precautions should be taken to keep you and your family safe from the spread of infectious disease, including the newest threat of Ebola. So that's from Supervisor Watson.
And we appreciate that.
And other than that, I heard on the radio that there is like a vaccine and all sorts of things, but they're not approved by the FDA yet. Is there any truth in that?
There are some vaccines that are under study, but they're nowhere close to being prepared. And off the top of my head, I don't remember if they're based in the United States or if they're originating from another country. I do not recall. But certainly there is nothing, the second part is absolutely correct. There is nothing that's licensed and available out there left and right. That part is correct. Other questions? We can hear you, but the video participants cannot.
So once outside the body or outside the host and onto a surface, what is the viability of the virus at that point?
Okay, in a laboratory setting,
No, just in a normal work setting where you sneeze onto a window or a desk.
not very long. If you disinfect it with something with bleach water, it will die. UV light, sunlight on a windowsill will kill it. Once it dries up, it's gone. It is no longer viable once it dries up. So unless you have a puddle of something, that would be your concern. A puddle of vomit or feces or something along those lines, that would be your concern.
So do we know a time limit if it's in a puddle? Is it once it's out of the heat of the body or something?
Okay, so the question was, do we know a time limit once it's out of the body if it's in a puddle? And let me tell you, the most beautiful illustration of that would be something in Africa when a person dies, their mattress and their body and their clothing, all of those puddles of fluids that remain behind can remain infectious for a long time. a long time, probably days.
I had introduced myself to you as you had approached me earlier as the Mojave County Public Fiduciary. So my concern is for my staff that obviously enter the hospitals all over Mojave County on a regular basis. And your slides discuss, you know, that it's not airborne, that you can't get it walking through the hospital. And I struggle a bit with that because, and I just want to, you know, I'm just getting this out there because my concern is for my staff and myself even when I enter the hospital. I guess theoretically and opportunistically, if one of us were to walk through the emergency room and someone had come into ER and sneezed and they had Ebola and had not yet been taken back to quarantine and we happened to walk through that sneeze and breathe, I mean, I know this is way out there, but is it safe to say that we are potentially at risk of being infected at that moment with the virus?
If you walked past a person within 3 feet and they were terribly, terribly ill and infected with Ebola, which would not likely be the person sitting in the waiting room, you're already probably undergoing organ failure. You are very sick. That is the only way if you walked right past and you took those droplets directly in. So I would not be concerned about the sneezes and the coughs in the waiting room of an emergency room. Where I thought you were going to go is if I stepped through a puddle of vomit, something along those lines. The story is still the same. Whatever that fluid is, it has to go directly into your mouth from the person or from the puddle, directly into your mouth, nose, eyes, or an opening in your skin.
So someone who's sitting in ER, for example, that has just simply a fever, but they do in fact are infected with Ebola, if they happen to sneeze and we walk through it, is it fair to say that the risk is low in your opinion?
Absolutely. And that goes back to the idea that once you're infected, the amount of virus inside of you grows exponentially. You might not actually have a high enough viral count in you to show up on a lab test for 3 days. So there is a period of time when you could have a very low viral load. And so the person who just has a fever, they're at that other end of the spectrum. And it is very unlikely that the person who's well enough to be waiting in an emergency room, still upright enough to be coughing or sneezing, or just has a fever, it is highly unlikely that they're going to be infectious enough. And once again, you would have to get some of that sneeze, some of that mucus, some of that saliva directly from that person into your eyes, your nose, or an opening in your skin. And I think Christy had a little bit to add to your questions too.
Yeah, I do. Actually, there has been extraordinary amounts of work and coordination between the hospitals here in Mojave County and the Public Health Department to address exactly that. So there are practices in place in each of the hospitals to identify somebody who, matter of fact, even before they reach the hospital, to identify somebody who has had travel, who has fever, who has symptoms that could be a potential case. And so once that's identified, then the whole entire public health system, which includes hospitals and healthcare providers and public health, we all come together and we put our individual plans in place to make sure that that does not happen. So we have had incredible cooperation from our hospitals. I'm very, very, very pleased with what we've had happening here. Sure. One more question from... Yes? And then I think this is our last question. We'll wrap it up.
Thank you for the presentation. It's been wonderful. But one thing that has not been addressed yet that I'd like to know, because the holiday season is coming up, and I know a lot of us will be traveling by air, are there any special precautions we should use while we're waiting for our flights at the airport and while we're sitting there for hours breathing this recycled air? Thank you.
Well, aside from do not spend your holidays in West Africa, yes, that's a very fair question given air travel and everything that's been in the media recently. The same basic premises apply. To get it on an airplane, you're only going to get it from a sick person or the bodily fluids of a sick person. And it would basically have to be a sizable amount of that fluid. So you're not likely to get it from just touching a surface. It would probably have to be a sizable puddle of a bodily fluid that would be on that airplane. What do you want to add, Christy?
Hello? Okay, so in addition, I think you guys, anybody who's watching the news understands that there are screening procedures in place. So from the latest information that we have, there's screening procedures from folks that are exiting West Africa, as well as those entering the United States from that location. So there's actually additional screening procedures that are in place, and the identification of those that have traveled from these areas to these states. And so there's like a follow-up process from those individuals. So I think with these additional screening procedures that have been implemented, I think there are other things out there too. So other diseases besides Ebola, but I think if we're smart and we just take those steps that we've talked about, we're doing our job to protect ourselves from Ebola. So I think that is it for tonight, and we do thank you all very much for coming out and asking very, very good questions tonight. We appreciate it. Thank you.